My name is Dr. Emily Kiberd, and I'm a chiropractor. So before these courses, some of the challenge that I ran into with my clients was doing kind of traditional chiropractic where I would adjust them and do soft tissue work. Maybe I'd give them an exercise and then they would want to go back to whatever they want to do. They wanted to go to CrossFit or lift weights, and I didn't feel like I had the tools to give them success getting back to what they wanted to do. I felt like maybe they just had to keep coming in and getting adjusted and more soft tissue work if they were in pain versus actually being able to look at their lifts, look at how they're moving, look at how they're loading, and then really give proper exercises to get them back to what they love to do. During these courses, a couple of the ahas that I discovered were how to pressurize, how to create intra-abdominal pressure properly, not only for the gen pop or the desk jockey who sits at their desk all day, but also the athlete. And so really having tools or cueing or how to feel it, putting my hands on someone's body, but then also giving them very good cues to get them into position. So if they're deadlifting, it's not just sitting your heels chest up, right? Because that's actually not a very good cue, but actually being like, okay, this is where your feet are. This is exactly where you should breathe. This is exactly how you should pressurize. So not only I can see someone doing it properly, but that they also see it and feel it in their body. I realized this was gonna help when I felt it in my own body. So I have a history of low back pain, always kind of being turned one way, working on people on one side of the table. And to be able to get myself out of pain very quickly, like within a couple minutes, versus a 15-minute warm up, or I always had to do something before I worked out. It's like, now I have the tools to know exactly what to do to get my own body out of pain. When you feel that, it's like, oh, I have to use this on my patients. My whole goal for my practice is to get people better out of pain, give them the tools to then go do what they want to do. I'm not the typical chiropractor that's like, come in twice a week for the rest of your life. And so the tools I learned from this course do exactly that. It's getting them out of pain, it's giving them tools for them to take care of themselves and to get them back to what they love to do. And if they need me, I'm there in the office, but the goal for me is to not be seeing people on an ongoing basis, but to really empower them to take care of themselves. And so the tools that I've learned in this course has done exactly that.